imagine this. You walk into a residence room, maybe in a long-term care facility, and there's a trash can actually on fire.
Wow.
Or maybe you hear a resident, they're suddenly clutching their throat, can't speak at all. What's the very, very first thing you do?
Yeah, that split-second decision.
Exactly. That immediate sort of gut-level response, the one that kicks in when seconds really, really count well,
Yeah.
that's the heart of our deep dive today.
And this isn't just, about memorizing a list of rules. It's more like a shortcut to understanding the essential knowledge and those quick decision-making skills that are just absolutely critical in these settings.
Right.
We're basically pulling out the foundational principles from real-world situations, the kind that demand immediate, clear-headed action.
All to ensure safety, uphold dignity,
Right.
and really foster the best possible quality of life for residents.
Precisely.
Our mission today, then, is to move beyond just the protocols and really uncover the critical thinking and, I think, the compassionate care that leads to those real aha moments when you're supporting vulnerable people.
Yeah.
So we'll unpack immediate responses, the power of just being really observant, the huge significance of resident rights, and the professional responsibilities that underpin excellent care.
It's a comprehensive look, really.
Yeah, what it means to be well-informed and effective. So let's jump in.
Okay, so safety. First thought always has to be the resident, like that fire scenario you mentioned. Your first instinct might be, grab the extinguisher, right? But the immediate priority is always getting that resident safe, above everything else.
And that's where that RACE-E acronym comes in handy, isn't it? It's like your instant mental checklist.
Exactly. RACE.
R is remove, get the resident out of danger. A is activate the alarm. C, confine the fire if you can. And E, extinguish.
But like you said, that R is first, always. Secure the person, then you deal with the fire.
Seems simple, but under pressure, that sequence is vital.
Absolutely vital. And sticking with immediate safety, let's talk falls. Huge risk for elderly residents.
Oh, definitely. Preventing them is just paramount. And tools like a gait belt or transfer belt, they're indispensable.
Absolutely. And they're not just for, bed to chair moves. A properly used gait belt helps you steady someone when they're walking or transferring, gives you that control.
Yeah, maintains their balance.
Yeah.
How do you put it on right?
Okay, so waist level. Snug, so you can fit maybe a flat hand underneath, but not tight enough to restrict breathing. And always over their clothing.
Gives you that firm, secure grip.
Exactly. Now, even with the best precautions, falls happen.
Right.
And if a resident does fall, this is so crucial, you never try to move them yourself.
Golden rule, don't touch them.
Don't touch them. Call for help immediately. Keep the resident calm, keep them still. Moving them could easily make things worse, especially injuries you can't see, like a fracture.
Yeah, absolutely. And it's often the little preventative things, isn't it? Like helping someone stand up after they've been lying down. That dangling technique.
Oh, yeah. Letting them dangle. It's simple but effective. Just have them sit on the edge of the bed, legs hanging, for a few minutes.
Why does that work?
It lets their blood flow adjust. Helps prevent that dizziness you can get right after standing up.
Which is a huge fall trigger right then.
Exactly. And similarly, if you're walking with someone and they suddenly feel dizzy or faint, ease them down to the floor gently if there's no chair right there. It's a controlled descent. Safer for everyone.
Safer for them, safer for you. And just a basic thing, always leave the bed in the lowest position when you're done with care.
Yes. Makes it safer getting in and out. Simple habit, big impact.
Okay, moving to another critical area, oxygen therapy. Oxygen gets delivered through tubing. Maybe from a concentrator to a nasal cannula, that sort of thing. Your role here seems simple, but it's vital, right? Making sure that tubing isn't kinked or pinched.
Absolutely life-saving. If that tubing is blocked, they're just not getting the oxygen they need. Simple as that.
But here's the really key part, I think. Oxygen is considered a medication.
That's the crucial point. It is a medication, which means as a nurse aide or care professional, you are never allowed to adjust the flow rate.
Never. Even if they ask, like, I feel short of breath, turn it up.
Absolutely not. Even if they ask, even if they insist, you report that request straight to the charge nurse. Immediately.
Why is that so strict?
Because changing that rate can be incredibly dangerous. It can mess with their blood oxygen levels, could lead to respiratory depression, organ damage. It has to be precise. Only qualified personnel can adjust it based on orders.
Got it. And the other big safety warning with oxygen?
It's combustible, highly combustible. It feeds fire like crazy.
So no flames anywhere near it?
None. No smoking, obviously. but also no lighted birthday candles, nothing like that. Seems obvious, but you have to be vigilant. It saves lives.
Okay, good point.
Yeah.
Let's talk about burns. Hot liquids, for instance. What's the immediate first aid?
Right. Hot liquid burn happens. Grab a towel or napkin, wet it with cool, not cold, cool water, and place it right on the injured area.
Not ice. I might think ice.
No, definitely not ice. Ice can cause more tissue damage. Just cool water.
And prevention, again, is key here.
Always. You have to alert residents about hot foods, hot drinks. Elderly skin is thinner, much more susceptible to burns. What feels warm to you could really injure them.
And for things like showers or foot care, temperature checks.
Crucial. First, you check the water temp yourself, ideally with a thermometer. Keep it under, say, 115 Fahrenheit, 46 Celsius. But then, and this is vital, you ask the resident to check it too before the water touches them.
Why?
Because their sensation might be impaired. Diabetes, age, other conditions. They need to confirm it feels comfortable and safe for them. It empowers them to.
That makes sense. That fragility of skin you mentioned, it also makes them prone to skin tears or shearing. What's shearing exactly?
Yeah, shearing is nasty. It happens when the skin kind of sticks to a surface like a bed sheet, but the underlying tissues keep moving when the person is pulled or dragged. The layers of skin separate.
Ouch. So how do you prevent that?
You avoid pulling or sliding residents. Always. Use techniques like rolling them or use turning sheets, lift sheets. Reduce that friction.
Even simple things like long sleeves can help.
Definitely. Adds a little layer of protection for that delicate skin.
And that leads right into pressure ulcers, doesn't it? Another big skin issue.
A very serious one. They happen when pressure, usually over bony areas, restricts blood flow for too long. The tissue starts to break down.
Bony areas, like hips, elbows, heels.
Exactly. Anywhere bone is close to the skin, those are the pressure points.
So prevention is repositioning.
Constant repositioning. Turning and repositioning residents at least every 2 hours. That's the standard. It promotes circulation to those vulnerable spots.
And you need to be watching for early signs.
Absolutely. Keen observation. For light-skinned residents, you'll often see redness that doesn't go away. For residents with darker skin, it might look different, maybe purple or a different texture. You report any change like that immediately. And make sure they're positioned off that area.
Ignoring it can lead to terrible problems.
Excruciating pain, infections, long healing times.
Yeah. And related to skin, but specifically feet, diabetic residents.
Ah, yes. Diabetic foot care is critical. Because of changes in circulation and sensation, they might not feel a sore developing.
So they need daily checks.
Daily checks. Look for any sores, blisters, redness. Catching things early can prevent serious complications. We're talking infection, even amputation.
And never let them walk barefoot.
Never. Always wear proper footwear.
Okay, let's shift gears slightly. Immediate life-saving stuff.
Choking.
Right, terrifying situation, the universal sign.
Grasping the throat, can't speak.
Exactly, can't speak, can't breathe properly, you have to act instantly.
And the action is abdominal thrusts, Heimlich maneuver.
Abdominal thrusts, yes.
Right.
Unless the person is very obese or pregnant, then you switch to chest thrusts. But speed is everything.
And preventing choking or aspiration during meals, especially if someone's in bed.
Super important. Aspiration is when food or liquid goes down the wrong pipe into the lungs.
Right. So, if you're feeling someone in bed, the head of that bed must be raised significantly. At least 60 degrees, maybe even higher, like Fowler's position.
That angle makes a huge difference.
Huge difference. Gravity helps keep things going down the right way, prevents choking and aspiration.
What if you notice someone coughing a lot after drinking?
Consistent coughing after drinking, that's a big red flag for dysphagia, difficulty swallowing.
So stop feeding.
Stop immediately. Report it to the nurse right away. That coughing means fluids might be going into the lungs, risking aspiration pneumonia.
Okay. And what about after a seizure or if someone is vomiting?
Turn them onto their side, quickly.
Why?
Allows fluids like vomit or saliva to drain out of the mouth instead of being inhaled into the lungs. Simple action, potentially life-saving.
Okay, so much relies on just watching. Which brings us to the power of observation. You said it's maybe the most critical skill.
I really believe it is. You are the eyes and ears. Any sudden, significant change in a resident's condition, you report it immediately to the charge nurse.
What counts as significant? Give me some examples.
Okay, concrete things. A sudden fever, maybe 101.4 Fahrenheit or higher. New confusion or delirium, even if they already have dementia, a change is key.
Right.
Becoming unresponsive, new swelling, say, in their ankles, or maybe they complain of chest pain, that's an emergency.
And reporting early can make a huge difference.
Huge. Early identification, early intervention. It can prevent serious complications, sometimes literally save their life.
And that observation helps spot specific medical issues too.
Right.
Like low blood sugar.
Yes, hypoglycemia, you need to know the signs. Shakiness, trembling,
Okay.
cold, clammy skin. Maybe they seem extra tired, weak, hungry. Could be a headache or sudden confusion again.
Lots of possible signs.
Very varied, but if you see a cluster of those, report it. They need sugar quickly.
What about heart attack symptoms?
The classics.
Hmm?
Pain radiating maybe to the arms, the jaw, looking pale, sweating profusely. Report that immediately. Don't wait.
And unusual walking, like a limp.
Yeah, say a resident with dementia is suddenly limping. First, check the simple things. Is their shoe bothering them? Sock bunched up? Rule that out,
Good point.
then report it. Also, be aware, residents with Parkinson's often have that characteristic shuffling walk, small steps. That increases fall risk, something observation tells you.
Okay. What about bowel issues, impaction?
Bowel impaction is serious. Signs might be subtle, liquid feces seeping out.
Liquid, that seems counterintuitive.
It does, but it can seep around the hard blockage. Also, look for abdominal discomfort, nausea, cramping. Report it. Needs medical attention.
And urine, what's normal, what's not?
Normal urine. Clear, pale yellow, no strong odor. Abnormal. Cloudy, dark yellow, maybe a foul smell. Report that. Could be infection or dehydration.
What if there's no urine in the catheter bag?
First step, check the tubing. Is it kinked, bent? Anything blocking the flow?
Check the simple stuff first.
Always. If the tubing is clear, then report it to the nurse. Could be a blockage higher up or a kidney issue. It's like being a detective, really.
I like that. Detective work. Especially with dementia, right?
Yeah.
Because they often can't tell you what's wrong.
Exactly. Residents with Alzheimer's or other dementias, their behavior becomes their language. It gives you crucial clues about unmet needs or problems.
Like restlessness, pacing, maybe rubbing their stomach.
Right. It might not just be agitation. Could be hunger. Could be they need the toilet. Could be pain or some other physical problem.
So check the basics first.
Always address basic needs first. Toileting, food, drink, comfort. If the behavior continues, report it to the nurse. There might be something medical going on.
And that phenomenon, sundowning.
Ah, yes. Very common. Residents with dementia often get more restless, agitated, confused late in the afternoon or evening.
So knowing that helps manage it.
It does. Facilities often plan engaging, calming activities specifically for that time of day to help minimize the agitation.
What about wandering?
Wandering can be linked to an unmet need thirst, needing the bathroom, maybe boredom, or just confusion, looking for something familiar. Try to understand why they're wandering.
Is that why some places use stop signs on doors?
Yeah, those large stop signs can sometimes help alert a confused resident, make them pause, and can help prevent elopement leaving the facility unsupervised, which is a huge safety risk.
And helping with daily activities, ADLs, like bathing, dressing.
Provide help, definitely, to avoid frustration. But, and this is key, always encourage them to do as much as they possibly can for themselves.
Maintain that independence.
Exactly. It's crucial for their dignity and self-worth, and for those sometimes unusual behaviors, like a resident carrying a doll, treating it like a baby.
Yeah. Or maybe someone keeps going up to a piano.
Instead of correcting them, like saying, that's not a real baby, you engage with their reality, offer comfort.
So like help them look for the baby's blanket.
Exactly. Or invite them to sit at the piano, maybe touch the keys. It's about validation, meeting them where they are. It can be surprisingly comforting, even trigger positive memories. It's not about playing along with the delusion, it's about connecting emotionally.
That makes so much sense. Which leads us right into dignity, rights, and really looking at the whole person.
The absolute heart of care, I think. Residents have fundamental rights, non-negotiable. Like the right to participate in their own care, make decisions about treatment.
Even if those decisions seem unwise to us.
Within legal and safety bounds, yes, their autonomy matters. And that includes privacy, even for intimate moments, say, with a spouse visiting.
What if you're unsure about consent, maybe due to dementia?
That's when you report your concerns to the charge nurse. Always err on the side of protecting the resident while respecting their rights.
And the right to refuse care. Can they just say no to a bath?
Yes, they can. They have the right to refuse. So instead of forcing or coercing, you respect that. Maybe ask why. Offer an alternative time, a different option, like a partial bath.
Show respect for their choice.
Always. Same goes for visitors, religious practices. If someone's praying, you don't interrupt. You wait. If they want to see clergy, like a Catholic resident asking for a priest, you help arrange that immediately.
These aren't just niceties, they're rights.
Fundamental rights.
Yeah.
And communication is how we uphold a lot of this. Effective communication is the cornerstone.
You mentioned validation therapy earlier.
Yes. Such a powerful tool, especially for confused residents. Instead of correcting factual errors like, my husband will be here soon, even if he passed away years ago, you engage with the feeling behind it. Ask questions that fit their reality. Oh, that's nice. What are his favorite dinners? Or, what do you like to do when your daughter gets home from school?
So you're validating the emotion, not the fact.
Exactly. It acknowledges their feelings, reduces anxiety, builds connection. It's incredibly empathetic and effective.
How else can communication help?
Use open-ended questions to encourage conversation. Not just, did you sleep well, but what kinds of things did you enjoy doing in the past? Learn about them.
Get them talking.
Yes. And when a resident refuses care, like we said, ask about preferences, offer alternatives, show respect.
What if they're angry or paranoid? Saying the food is poisoned. Okay, crucial here. Do not argue, do not correct or disagree. Stay calm, maybe take a step back for safety if needed, listen to their concerns,
And
then offer an alternative. I understand you don't want this. Is there something else you might like to eat? De-escalate, validate the feeling, offer a choice. Don't get drawn into the paranoia itself.
what about grief? If they talk about lost loved ones?
Let them talk. Be a sounding board. Listen actively. Acknowledge their loss. Talking is often part of the grieving process. Just being there is huge.
And general communication tips.
Speak respectfully, privately, especially about sensitive things like toileting. Use pictures or gestures for language barriers. If they have a hearing aid, check if it's on first.
Common sense, but easy to forget.
Right. And even with someone who is comatose, unresponsive, keep talking to them, explain what you're doing. Hearing is often the last sense to go. They might still perceive your presence and voice.
Wow, that's powerful. Okay, mealtime, nutrition, vital, right?
Absolutely vital for health, healing, energy. We need to remember key nutrients. Protein, meat, eggs, beans, soy, nuts, that's for tissue growth and repair.
And carbs.
Carbohydrates, pasta, rice, breads, that's their main energy source. Fuel for the body.
And we need to encourage them to eat, especially if appetite is poor.
Definitely. Taste and smell can decline with age, making food less appealing. So, offer choices. Find out what they like. Make mealtime pleasant.
What about NPO orders? Nothing by mouth.
Strict adherence means absolutely nothing by mouth. You have to remove everything, water pitcher, glass, ice chips, everything. It's usually for safety before procedure or due to swallowing issues.
And someone has shaky hands. Spills.
Simple adaptations help. A cup with a lid, maybe weighted utensils, prevents spills, especially hot liquids causing burns, and helps maintain their independence in eating.
Great tips. Let's talk mobility, rehab, restorative care. What's the main goal there?
Restorative care is all about helping residents improve function, strength, abilities, gain back as much independence as possible.
Focusing on progress.
Exactly. Help them focus on even small accomplishments. Celebrate the small wins. It's motivating.
And always keep things within reach. Call light, water.
Always. Especially for those with limited mobility. Prevents falls when they try to reach for something they need. Essential safety.
When dressing someone with a weak side, maybe after a stroke.
Right, the affected side. Always dress the affected side first. Put the sleeve on the weak arm first. Pant leg on the weak leg first. Makes it much easier and less painful.
Good tip. Add range of motion exercises.
Yeah.
ROM.
These can often be done during daily activities like bathing, moving joints through their range.
But don't force it.
Never, ever force a joint beyond where it comfortably moves. That causes pain and injury. If it's passive ROM, where you are doing the moving for them, you need to provide full support.
And foot drop. What's that and how do you prevent it?
Foot drop is when the muscles in the foot weaken, causing the foot to hang down. Makes walking very difficult or impossible. For bedridden residents, using a footboard can help keep the feet in proper alignment, preventing those muscles from shortening.
Okay. Bowel and bladder health.
Yep.
Dignity and comfort again. Retraining programs.
Yes, bowel and bladder retraining requires real consistency, following a strict toileting schedule, maybe every 2 hours, often aiming for a bowel movement after a meal, using the body's natural reflex.
What helps promote regular bowel movements generally?
Several things. Routine toileting times, answering the call light promptly when they feel the urge, privacy, sitting upright, ideally on a toilet, activity and exercise, high-fiber diet, plenty of fluids. It's a whole package.
And preventing continence means being quick.
Responding quickly to call lights is huge. Bladder control can change with age, urgency increases. Getting there fast can prevent accidents and preserve dignity.
And perineal care if an accident does happen.
Immediately, as soon as you know they're soiled, prevents skin breakdown, prevents infection, and it's just basic dignity.
Any specifics on technique? Uncircumcised male?
Yes, important detail. Gently retract the foreskin, clean the area thoroughly, then always return the foreskin to its normal position. Forgetting that last step can cause serious swelling and pain.
Got it. And urinary catheters. Drainage bags.
The bag must always be below the level of the bladder. Always, always.
Why?
Prevents urine from flowing back up into the bladder, which can introduce bacteria and cause infections, and keep the bag off the floor. Floors are germs.
Makes sense. Okay, last major section. Professional responsibilities and boundaries. Huge area. Scope of practice.
Absolutely fundamental. A nurse aide must never perform tasks outside their state-defined scope of practice, period.
What if a nurse asks them to do something outside that scope?
You respectfully refuse. Explain that it's not within your scope of practice as defined by the state. It's about safety and legality.
What if you just don't know how to do an assigned task? Maybe first time doing postmortem care or changing a certain type of bag.
It is your responsibility to speak up. Tell the nurse you haven't done it before or need instruction or supervision. Never just wing it. Patient safety depends on competence.
So no adjusting oxygen, no discontinuing feeding tubes, no deciding to thicken liquids.
Absolutely not. Those are medical decisions or require specific licensure. Always get the nurse. Your role is vital, but it has clear boundaries.
What about new residents, if you don't know their care plan yet?
Always get specific instructions from the charge nurse first. How much help do they need for toileting? Transfers. Ambulation, don't guess. Assumptions are dangerous.
Okay. Reporting abuse and neglect. Non-negotiable.
Completely non-negotiable. It's a legal and ethical requirement. You must report any suspected or observed abuse, verbal, physical, sexual, emotional, or neglect. Doesn't matter who did it. Staff, family, visitor.
Examples. Yelling, hitting.
Yes, yelling, cursing, hitting, that's abuse.
Fine.
Neglect is failing to provide needed care, like not giving perineal care to someone incontinent, letting them sit in soiled linens.
What if you suspect the charge nurse is involved?
Then you go over their head, report it to their supervisor, the director of nursing, or follow the facility's reporting policy, which might involve an external agency. You must report.
And consequences for the caregiver if neglect is proven.
Serious. A finding of neglect can mean losing your certification, being barred from working in healthcare facilities, but the real consequence is the harm to the resident. That's what matters most.
How do you prioritize tasks? Start of the shift.
First thing, check on all your assigned residents. See if anyone has immediate needs, toileting, repositioning, wanting to get up. Quick rounds.
And if someone needs help right at the end of your shift,
An accident.
you deal with it. You never, ever leave a soiled resident for the next shift. It's unprofessional, undignified, and unsafe for the resident's skin. Address immediate needs promptly, always.
Well, what if a resident is in distress, having a seizure?
Do not leave them alone. Never. Call for help immediately. Use the call light. Yell for assistance if you have to, but stay with the resident. Ensure their safety. Provide comfort.
Your presence matters.
Immensely. And respecting family. Sometimes they give advice, seem critical. Try to understand it usually comes from love and concern. They want the best for their loved one, want to feel involved. Don't take it personally. See it as collaboration. Builds trust, right? Sees the resident as part of a family.
Exactly.
Yeah.
And finally, end-of-life care. Advanced directives, DNRs.
Right. Advanced directives outline wishes for future care. A DNR, do not resuscitate order, means specifically no CPR or heroic measures if the heart stops.
And the focus shifts.
Completely. End-of-life care focuses primarily on comfort, on quality of life, pain management, emotional support, spiritual needs. Respecting their documented wishes is paramount. It's about honoring their final choices.
Wow. So we've really covered a lot of ground today, a true deep dive, like you said.
Yeah, from those immediate safety actions like RACI and handling falls.
See the incredible importance of just watching, observing, noticing those small changes.
Then upholding dignity, rights, communicating with compassion, using things like validation.
And finally, knowing your professional role, your boundaries, your responsibilities, especially reporting abuse and respecting end-of-life wishes.
We hope understanding these specific, really practical scenarios gives you, the listener, that shortcut we talked about. A deeper insight into the complex, crucial decisions made every single day in care settings.
It really does reveal the hidden layers, doesn't it? It's not just tasks, it's constant critical thinking and human connection.
Yeah. So maybe a final thought to leave you with.
Mm-hmm.
Beyond all the procedures and protocols we discussed, what does this deep dive truly reveal about that human connection and care?
That's a great question.
How do these seemingly small, specific actions, checking water temperature, repositioning someone, listening to a story, reporting a subtle change, how do they profoundly impact a person's comfort, their safety, and ultimately their dignity, especially at such a vulnerable stage of life?
Something definitely worth thinking about.